Direct from Foxborough, Massachusetts, the gem of Norfolk County, and taped at the studios of Foxborough Cable Access. It's Foxborough Central. And here's your host, Bob Hickey.
And welcome to another fantastic episode of Foxborough Central. I am Bob Hickey, your host, and I want to thank you for taking the time to join with me and my guests as we talk about the people, events, and organizations that makes Foxborough truly the gem of Norfolk County. My guest today is a young man, Mateo Emmanuel Alejandro Cox. Mateo,
pleasure to meet you.
I'm not going to say that name too many times because that's a
that's
a good one. That's a good long name. I like it. I am here with Mateo, and we are going to talk about a topic that's a little bit heavier than most, so I hope you will stick with us and perhaps really embrace the fact that we're bringing this subject matter to you. Mateo is a suicide prevention speaker, correct? Correct. And you go to schools and talk about what?
Sure. So I work for the NAN Project. It's located in Lexington, but we travel all across Massachusetts. And it started in 2016 by my wonderful boss, Ellen Dalton, and her son, Jake Kavanaugh. Unfortunately, they lost their daughter and her sister as well to suicide in 2012. And they were really struggling with it for quite a few years of wondering what were the signs, how could it have been prevented, and we really wanted to bring that empowerment to other folks to make sure that could be prevented, since we all strongly believe suicide is preventable. So what they started to do was they did some research of knowing, well, who helps kids that age the most, in college or younger. And it found that we didn't really start talking about mental health until we get to college because it was treated like a rated R subject.
Sure. That
it was seen as inappropriate if it was ever brought up, and even health classes was very washed over. Even my education, I reflect on it. We really didn't talk about mental health. And so we wanted to bring those conversations into schools in a way that was safe and peer friendly, and we use a peer model. So we actually do like some trainings for the peers to know where to go, who to talk to, and to consider the different levels of sociology of like who's high risk versus of certain interventions, which ones to steer away from and which ones would be more appropriate.
Isn't that the weird thing about, and as people who know Foxborough Central, I don't script this, so isn't that the weird thing about children is we somehow as adults believe that if we talk about something, it's going to make them want to do it. If we talk about cigarette smoking, then all of a sudden the kids are all going to run out and smoke cigarettes. We talk about the evils of alcohol, or we even talk about how to safely use a gun. All of a sudden everybody's going to go out and drink and smoke and shoot guns. And that's really not the case, because education is power.
Oh, for sure.
And the stigma associated with mental health, with depression, with drug abuse and addictions, if we peel away those layers and get down to the real issue, then that's the first step in addressing any of these things, right?
Absolutely. That's something we've actually...
So good for you for doing this and running out and not shying away from this topic matter, because not everybody can do this.
Right. It's one of those things where we have to address it because suicides have gone up rapidly statistically in Massachusetts and nationwide. And that's something, yeah, absolutely. It's something that we look at every year, the statistics. I think the most updated version was in 2018 or 2017. I don't want to throw any wrong statistics out there. But it is alarming that we can't afford to sweep this under the rug anymore. And that's something that we actually have addressed in our presentations before, is that it does not put the idea in somebody's head to bring it up. If anything, it brings relief, because one, that person knows you're a safe person to talk to if that ever comes a day when they're feeling that way, or two, if they're already feeling that way, they know that they can just talk about it and we're not beating around the bush. We use the QPR method of just acting directly. We don't want to say like, oh, you're not thinking about it, are you? And dancing it around, kind of dancing around it. We want to be, are you thinking of suicide? Do you have a plan? And what helps you right now? It's better just to ask it so that person doesn't have to do the whole dancing around. We just want to get right to it and have that person be like, okay, and be able to say what's going on. QPR. So it's question, persuade, refer. So we'd ask the question directly, are you feeling suicidal? We don't add any opinions on it. We don't add how we feel about it. We just ask them the direct question. Persuade them to get help. So it's not so much that like, oh, we're going to talk you out of it right in this moment. It's more like, who's your guidance counselor? Do you have a safe home? If not, who is a peer you can go to who would have resources, who could be, it's about just bringing them to the right person. And that's more what we refer as like, do they need help right now? Or is it a matter of talking about different coping skills, or even if just they can arrange a time to hang out after school, would that be able to de-escalate them and then be able to get a therapist and, start the process of that? And it's about the individual person, but really about how to do it on a peer level and not so much a clinical perspective.
So you're that first level intervention.
Exactly.
And then you refer to the trained professionals who can give continuing care.
Exactly. So we're not so much about being the resource, it's more of being the preventative resource right there, and then referring to them to a more appropriate step.
That's
so
great.
we don't talk about that in schools. We need to bring that into that conversation. And so I'm really happy I've been doing it since 2016. I was actually one of the first graduating class of that, yeah. Okay. I actually graduated college in 2017 with 2 associate degrees from Quincy College, and that's been life-changing for sure.
Love Quincy College.
Oh, they're great.
Place.
They're so great. So it was a behavioral science degree and a human services degree. So I got 2, and I loved it and went out to the field and actually worked with students with disabilities and helped them find a job and just secure job employments like that and train them for the world. But we talked a lot about mental health and taking care of themselves too, because we wanted to acknowledge that when you go to a job, you don't leave your mental health behind either. So we had that approach too. So be able to incorporate what the NAN has done into that, it's been wonderful. But it certainly was a journey to get here. So
I'm going to ask you about that journey in just a second, as much as you're comfortable talking about it. I'm going to remind everybody I'm speaking with Mateo Emmanuel Alejandro Cox. He is a suicide prevention speaker with the NAN Project. If you'd like to find out more about the NAN Projects, they're on the web. They're a nonprofit organization. Their address is www.thenanproject.org. They can also be reached at area code 781-861-0890. They're on Facebook. You can be a subscriber, be their friend, and you can learn more about the NAN Project. And particularly if you have a loved one or a family member or even a coworker or a friend who seems to struggle with mental health issues or thoughts of suicide, it never hurts to have these resources available, because I guess at the end of the day, it's all about education and resources and understanding where to go to get help.
Right.
Because the worst feeling in any situation is either not being heard, not being believed, or not knowing where to go.
Right, exactly. And that's usually the tipping point. Is sometimes I've seen, not even sometimes, the majority of the time I've seen people find those resources after they've had a crisis or during a crisis. We want to bring those in before so we can
and that's the toughest thing. And suicide is an issue just as any other issue is an issue. And until you get to that tipping point, drug addiction, when is my drinking problem too much? When is my not showing up at work on time too much? When is not going to school on a regular basis? When does it become too much? Well, obviously, it's when the truant officer comes finding you or you fail the grade. Obviously, it's when you lose that job, or obviously when the drinking starts affecting your personal relationships or your professional life, or driving.
Exactly.
And so it's all these things. There is
everything.
a tipping point. I guess the worst part about suicide is that tipping point can sometimes be successful.
Right.
And that's the biggest tragedy of all, correct?
Oh, for sure. I mean, I've spoken with so many survivors of suicide attempts, and when we go into schools, we talk about why we're glad we're still here, because we're very honest about this is our history, but here's how I got help and how I got through it. And we emphasize that it's not the smooth, happy ending. I feel like we're so quick to want to jump to happy endings. But we take a very honest approach to saying we still have mental illnesses. We still struggle, and there are days where sometimes you just have to call to work to have a mental health day, but you're still alive because you're still going to therapy, you're still trying medication, or if it didn't work, you try another one. If it doesn't work for you, that's okay, but I tried this coping skill. We really emphasize everybody's right to autonomy and just the reality that this is ongoing. Just like if you have other illnesses and you have to manage it, like diabetes, you have to manage it. You don't want to say that, oh, I struggle, then it's over. It makes kids not trust us. We want to be very honest that this is ongoing, but it's manageable when we're walking examples of that, and you can do it as well. And we want to bring those resources in to make sure they're able to.
Well, we keep saying we and I, so I guess now's a good time to say, how did you get involved with this? What made you become a person who felt that their mission was to go out and share and try to speak to this?
Well, thank you. It's definitely a heavy story for sure. But in 2007, I was in a hospital, and it was actually a psychiatric hospitalization. I was heavily bullied at the time. I was known as I'm transgender as well. So this is before my transition. I was seen as the bisexual girl because I came out as gay before, and it was one of those things where middle school kids aren't so nice. And I'd like to say we've come a long way.
I was going to say, and by the way, you're 10 years old at this time?
I was 12.
You're 12 years old at this time.
Yep.
Transgender before transgender
this
was
is
a
before.
thing.
Well, I mean, it's always existed, but this is before I transitioned personally.
But I mean, before society understood it as globally
it wasn't
a
as
thing.
commonly understood, for sure. And even just being bi, like this was even before the trans monkey wrench got thrown in there. People even more head spin, unfortunately, with that. But I lived in a very small town where everybody knew each other's business, and people were talking, and I couldn't get away from that. So eventually it escalated.
Set the stage. Okay.
Yeah, it set the stage right
And you're
there.
12 years old, and everybody knows how wonderful middle school is because everybody's always so embracing and understanding and just loving of each other, correct?
Oh yeah, for sure.
Okay, good. So we've
Sarcasm
got the
there, for
stage
sure.
set. Good.
Exactly. So you can only be bullied for so long without having it start to escalate. I already had pre-existing, bipolar disorder, and it was just only fueling the fire.
Was it diagnosed? Or
It
were you
was. Yeah, I was diagnosed.
So you
as
knew you
bipolar.
had this.
Right. Right.
That's a heavy diagnosis to carry at the age of 12.
It was. It certainly was, especially because, I was starting puberty at that time. So it was like everything was out of control. I didn't really understand what was going on. I mean, I understand myself now because I actually now have resources and education about it. But back then I was wondering what was happening to me.
But then again, we go to the tipping point issue of we don't know, I'm alone, nobody understands.
Right.
And to a certain degree,
in.
there's truth in that.
For sure. I think that we had the very surface line of, oh, this is a guidance counselor, but what can a guidance counselor really do once it escalates past, somebody's bullying me in school? I'm not downgrading bullying at all, it's very serious, but when it escalates past a certain point, you got to address it.
But, you bring up several points because bullying, there's actually a school district or a town that's passing legislation, who knows, it'll stand up constitutionally or to a court challenge, but where it will fine the parents of kids who bully others $50 in today's Boston Globe.
Oh.
And I thought that was very interesting. I think, isn't that interesting? Because at what point are you responsible? Do you hold others responsible for your behavior? And for children in particular, there is that presumption of juvenile, part of growing, part of learning,
right.
And who do we hold responsible? And then we get to your situation,
right.
Not having met you before a few minutes ago, but you get to your situation where you were bullied and you had mental health diagnoses, and then you had a transgender or an identity issue that you're probably working through, because we can have a jolly conversation now in 2020 hindsight, we can look at it analytically.
For sure.
But at the time you're going through it, my gosh, I cannot
Yeah,
imagine.
there was a lot of factors there for
the
sure.
pressure and the confusion and the anger and the joy and everything that goes into it.
Yeah, and it was enough going on internally, but it was once it became more external, where people started making up rumors of certain things I was doing, because there was a lot of conspiracy theories back then that gay people are predators and all the jazz. And eventually I couldn't handle it anymore and was hospitalized with, after a suicide attempt.
Okay.
But during that time, unfortunately, there was that Virginia Tech shooting. And that was blasted over the news because, this is back when school shootings were just not consistently a thing. And that was when schools around the nation started doing a zero tolerance policy, saying, absolutely no mention of guns, no violence, they wouldn't tolerate anything. And so our principal made an announcement saying that if there is any news of a threat, you'll automatically be suspended first and then investigated, because they were taking this so seriously. Unfortunately, the media made the mistake of saying, oh, this man had mental health issues, and they really embellished those. And people started saying, well, this person's been bullied, and this person has bipolar, and this person just got out of a mental hospital, and there was a lot of stigma behind that.
Remember that incident, I do recall that there was because unfortunately now it's become more commonplace, which is a sad testament on a whole nother level.
Right.
And perhaps we'll come back and we'll have a roundtable discussion about that on another program. But I do remember that. I'm from Virginia, and I remember hearing the newspapers were openly speculating. I guess that's also a problem with the news cycle, is that the big sexy item is when it gets the headlines, but you got to make headlines, and so there's a lot of speculation and a lot of aha things, and then not really fully accepting responsibility for how those ahas would permeate down to
for sure. Children
everybody
are listening.
else.
Right. I think that sometimes we tend to forget that children around the nation are listening, especially if they're at schools and they need to know what's going on, and if that's the dialogue they're hearing, and they see the peers that have it. And at the time, I was known. I was heavily targeted, and it was well known at that point because, again, that small town, everybody knew my business.
And isn't that the craziest thing, where assumptions and accusations become the reality?
Oh, for sure.
And particularly if you're the victim of it, my gosh. Where do you go to? There's not just,
exactly. Once everyone's against you, where do you go?
I was going to say, it's not just some big arbiter. They say, hey, this is really unfair, and somebody should stop this because this is the real world, and there's no somebody.
Right, and there was a trickle down of, I look back on my past and think there's a lot of people who could have stopped this. But what ended up happening was, there was a rumor flying around that I was about to go on a 5-day field trip overnight, and they didn't want a bisexual girl staying in the same cabins as them. So what would they say? Mateo set a threat. Even though I didn't, and I had a normal rest of the day. I had a normal rest of the day, went home on the bus, got home, and my mother comes out on the phone. She was angry, yelling, "You're suspended," and I was completely floored, had no idea what happened. And yeah, see, I wish I could laugh. I can't, because I was so in shock.
But that's the thing, to be falsely accused.
Oh yeah, it was horrible, because it flew around like fire.
It's kind of that,
it.
what is this saying, have you stopped beating your wife yet? Well, I never beat my wife. Oh, so you deny it. Or, yes, I've stopped beating her. Oh, so you were beating it.
It's one thing
either way,
you can't win it.
Exactly.
It's a whole other thing to unpack there too. But what ended up happening was the school said that we want to make sure, again, they put the mental health factor in it. We want to make sure you're a safe person to come back to school. So during your suspension, you need to go to the hospital and get an evaluation and a note to come back. So I went, and I'm thinking that this is all just a big mistake. I was 12. Like, I was, a dork who was getting mad when someone would take the less fruit roll-up. I was harmless. I was known as the person who was doing charity events for the past few years in my town. Like, I didn't know how I could be demonized so quickly in just a span of a few minutes. But when I got to the ER, they said, well, you have history of suicide ideation, and there's a lot of misinformation about suicide ideation that, if you're suicidal, you must be homicidal, even though I had not a homicidal bone in my body. So they admitted me inpatient, and unfortunately during that particular hospitalization, the staff there, luckily they were fired 4 years later, but that doesn't take away the fact that they were sexually abusing their patients on the unit.
Oh.
So yeah, so it was one of those things.
So let me see if I understand this. Not only and if you're involved in the community and you do good work, not only does the community turn on you, false accusation made, the school system, which is supposed to protect you and be at least on the face of it an arbiter of right, they turn on you, and then the place that they send you and you voluntarily go to get help turns on you and abuses you.
Right. I wouldn't say it was involuntary, but yeah.
And you're here.
So sarcastic. But yeah, I'm here. It was one of those things that was certainly a journey to get past that, and a lot of disbelief. But
so as far as setting as far as setting credentials, you've done a phenomenal job. And so, not to just say making lemons into lemonade, but you certainly have walked the walk. And so
Thank you.
Now you're here, speaking. Now, it's a long process to get from victimization to healer to teacher and leader.
Right.
How did you do that?
It was one of those things where the first year was incredibly hard because it was a lot of disbelief. Again, this was at a Catholic hospital, and there was a lot of, there's such a holy place. This is before the whole Catholic sex abuse scandal was exposed. So people were just not believing me, especially nurses and staff, and how could they possibly do that? And
just as
how to get past that hole.
It wasn't all that long ago that we didn't have these discussions. We didn't talk about
for sure. It's still rather new.
We didn't talk about transgender. We didn't talk about mental health in children. We didn't talk about anything.
Right.
So just to show you how far we've come.
Oh, for sure.
It wasn't
long way to
that
go,
long
but we're
ago.
still, I still
so
look
this
back.
is all relatively
still
new territory. And do you find that, by the way, when the NAN Project reaches out, or do you find a lot of pushback, a lot of resistance against having these conversations?
I mean, to be honest, when we go into schools, I see the students who really want to talk about it. You can see who is really resonating with. And so that's why we keep going. But when we do sometimes we'll speak with parents too. We'll have a separate event for them so their children don't feel uncomfortable talking about things in front of their parents. But that's when we get a little bit more pushback. But people who want to be there are there for a reason. It's hard to talk about. We'll advertise like crazy, but for the ones that are open to the public and not when we're in schools, it's hard to get people to come talk about because I think they want to avoid it. But when they're there, they get past the awkward stage and we start to talk about it. I see everybody feel more empowered every single time, and it's really powerful to see people who were strangers 1 minute are now connected with each other and telling each other's story, and it's wonderful. But yeah, that's the first year I really had to get past the anger and the grief, and the next few years after that, I was hospitalized quite a few times, 35 times.
Really?
For psychiatric, because I was having severe PTSD, nightmares, flashbacks, and just the whole thing. And I was 12. Like, what do you do when you already have, a diagnosis of bipolar, and then you add that factor in? And eventually just led to a whole downward spiral for a long time, and living in a group home for a year. So it was a lot in my teen years. But I eventually I reached a point where I'm like, this isn't working. I was really non-med compliant for a while because I was just like, I was frustrated. I wanted to just give up, and I had a lot of suicide attempts. But then I started to realize that, I'm going through something that very few people understand, and people who do understand usually, because of their own healing process, I've seen them hold back, and it's really empowering to see when I would see other survivors speak out. And I was really moved by that. I actually met a lot of mental health peer mentors who would work with me individually and other groups as well and tell their stories, and I found that very empowering. And that's when I decided that I wanted to be a peer mentor. And so I went through the process of the training and got my certification. That's where I actually met the NAN Project. They came to one of my classes and said, hey, we're hiring peer mentors, and we're starting this new project, and that's how I got involved with NAN. But I decided as far back as when I was 12 in 2007 that I wanted to be a counselor someday because, again, I was just not believed. I was gaslighted under the sun, like in so many ways. But I wanted to make sure that we can start talking about these things, so maybe even 12 years from now, even now in the present, we talk about things we didn't talk about 12 years ago. and so that we can keep those conversations going and those resources expanding, and I wanted to be part of that. So yeah, graduated 10 years exactly after 2007. It was very empowering.
Congratulations for being here.
Yeah,
this
thank you.
is on several levels. I want to remind everybody in speaking with Mateo Emmanuel Alejandro Cox. Mateo, my friend. He's a suicide prevention speaker with the NAN Project. So you can find them on the web. You can Google them up, but you can also go to www.thenanproject.org. They're on Facebook. You can be a subscriber and be their friend. 781-861-0890. There are a nonprofit organization. They should be supported. It's a very powerful topic, but also powerful work that you do. I cannot express appreciation enough the fact that you're actually here talking about it openly, because too often people who are not comfortable with something slide it aside. They don't want to talk about it.
We can't anymore.
But the fact that you're victimized, if we don't talk about it, that just allows the perpetrators to continue.
Right,
and
sure.
also allows those who should be in the position to say, whoa, wait a second, something's not right here. It allows them to get off the hook. Because I think that institution, we had our own issue here in Foxborough. We had a scout leader and a teacher who offended against multiple young boys. And he somehow managed to leave, went down to Florida. He was found out in Florida offending, and then it came back to our town, and the realization was, yikes, he did some very bad things here. A lot of the people still live here in town. It's our collective, aha moment as, this happened here. We're not immune from.
Exactly.
And it can happen anywhere.
It does.
And I don't know
I
what
think
small town you grew up
right.
in, but I think that's the key thing.
Exactly.
There are good people everywhere, but there are bad people everywhere also, and it's always.
There's a lot of distancing.
Yeah.
That we try to say, oh, that only happens in Boston, or that's a story. When something happens and it's far away, we get comfortable.
Right.
And my job is to make people uncomfortable and realize that, no, we can't be comfortable, because when we're sitting in our privilege of being comfortable, there's people being offended right now. And we have to look up for the signs and also call things out in our system of when people are failed. If you're not believing, you're automatically dismissing survivors because of their gender or their age or any category that they're in, you're doing that, you're being complicit, I call it, that you're enabling abuse to continue. So you don't have to be actively abusing to be engaging in being complicit.
And it sounds like, and not making assumptions, but it sounds like you're doubly offended against, because not only was there a false accusation, but the false accusation was believed.
Oh yeah, for sure, that was raging.
And that is just the worst feeling. It's kind of like playing a baseball game, and you know you're safe, and the umpire calls you out.
Oh yeah.
You know you're safe, and replay shows you're safe, but you're still out, and it's just so.
It was
because you know that I'm right and you're wrong.
Right,
and you're
it's
in
like
the
a
position
whole
of power,
mob that was,
and I'm powerless.
That was the mob concept.
And so at 12, you're already powerless because you're juvenile, and you're getting bullied, and now the people who are supposed to be looking out for you, the school department, perhaps even the police and authorities, they turn on you.
Oh, for sure. It's one of those things that we have to change the system overall, that we just don't want to put all the responsibility on the survivor to just survive and continue in life. Like, I'd really try to address it with the system as well. That this is why we go into schools and say, this is the warning signs. We're all on the same team here. It's not going to fall on the student to get help and resources. You have to look out for it. You have to look out for bullies and hold them accountable. Like, people tend to say to me, oh, well, you never stop bullying. Okay, bullying might always be a thing, but here's the thing. We're not holding the bullies accountable. And when they're held accountable and consistently, that's when it starts to, be actually hopefully decrease.
But also,
not perfect, but something.
Failure to address it means it's institutionally accepted. Just like institutional racism, institutional sexism, all of these things that we sometimes don't even realize we're doing.
Yeah, and I think, again, the distancing, we like to pretend it doesn't happen in our school or our job, or we don't see the racist thing in coworkers said to another coworker that could affect their mental health. We like to distance ourselves, but we can't do that. So it's one of those things that I live, obviously, a really intersectional life and had quite a past, but I really want to address it from an intersectional perspective too, that when you go into schools, you have to consider that, yes, we're doing suicide prevention, but you don't want to call the police right away if somebody is having a schizophrenic episode, and especially if they're a person of color. Like, you have to consider, there's things you have to avoid and consider your resource of who you're addressing. So I don't go over there and just give a general speech, and universally we try to change it up and be mindful of who we're speaking to.
Yeah, and then I guess the added problem is that not every community is, I don't want to say evolved because that sounds pretentious, but is in the same place from the standpoint of accepting. Sometimes you have strong leaders who can push the envelope and make change, and then sometimes you have leaders who are, colloquial, or who are, back in this is the way it is, and it was good enough for me, it's good enough the way it is. Or maybe I was a bully, and, well, that's the way I was in school, is just the way it is, right? Well, that person should just, man up and be tough.
Right. I mean, social justice issues are always existing, but it doesn't get talked about until it affects privileged folks, usually
and then
in power.
again, we get to that tipping point.
Right. And so as suicide prevention is starting to be talked about more, I'm wondering, like, okay, so now it's starting to affect their families, whether it's politicians or even people in other areas of political power. So our goal is to really work our way up, but really we want to focus on helping out who's most affected. So again, it's not a shameful thing to say that we acknowledge there's different levels of privilege, that if I go into a school that doesn't have the same resources for whatever reasons are systemically going on there sociologically, we're still going to change, like, okay, maybe they can't afford a guidance counselor or an adjustment counselor at their school. Again, unfortunate, but that's reality. So what are some nonprofit things? What are some cheaper things? What are some things that there's not a billion steps to go forward to? And even just access to public transportation or licenses. I'm not going to give the same speech to somebody who has access to public transportation that can get to a therapist versus somebody who might be in the middle of nowhere, Massachusetts, way far out in Western, and have no access. You have to consider all these things.
These are the realities, right?
Right. So I like the way NAN Project really approaches that. We are really mindful about which schools we're going to. We read about them. We speak with officials. We get to know who's the psychologist in the building, if they even have one, what's in the area. We really do a lot of research into that, and that's something I've always respected about how we roll. So keeping that going.
Mateo, we are almost out of time. I'm going to give you the last word. The NAN Project sounds like a fantastic, and from tragedy, and her name was Nan?
Well, yes, unfortunately.
So
Nan
and her
passed away
mom
by
and her
suicide.
brother are the ones who have put this together, and so much credit to them for stepping.
Oh, for sure. So
And
respected.
taking tragedy and turning it into something positive and helping others. So
they certainly have, for sure.
such good feelings to them and to you as well for surviving and thriving and becoming that person that can now go out and make that difference. Again, we're talking to Mateo Emmanuel Alejandro Cox. Mateo is a suicide prevention speaker with the NAN Projects. They are located on the web at www.thenanproject.org. What's your catchment area? What are your service area? Where do you go to?
I see. So we travel all over Massachusetts. We've gone as far as Pittsfield all the way down to Plymouth. We get the call and we go. We're right now, most folks know about us on the North Shore, but we're trying to get to the South Shore. We're trying to get more out. So by all means, spread the word and we'll be there.
Maybe people will know more through this program. You can also reach out to them directly at 781-861-0890. Be their friend on Facebook. You can send them an instant message. It's the way business gets done these days. So resources are a key component to any intervention, and it sounds as though the NAN Projects is not only a clearinghouse, but also can take that lead and do some referrals and help you get that help. A friend, a loved one, a coworker, somebody you know. The NAN Project sounds like a wonderful organization. Mateo, you get the last word, sir.
Well, first of all, thank you so much for having me on this program, be able to spread the word about the NAN Project and discuss such a heavy topic. But again, we want to make sure that we talk about these things. I want to give you a huge thanks for allowing me to have this platform to discuss these things. I'm hoping that somebody listening is now aware of another resource out there and also can see that it's doable, that it's not an easy path. And I'm very open and honest saying that I still struggle with it. It's not beginning, middle, end, period. It's an ongoing battle, but it's one that's doable when you surround yourself with the right support.
Well, if we can reach one person, then this will be the best program ever.
I agree. Thank you very much.
Thank you so much for being
here. It's been a
here.
pleasure.
Thank you, everybody, for being here. We do hope you follow us on our YouTube channel for this and other programs. If you missed any part of today's important program, you can check us out on Foxborough Cable Access's YouTube channel or at our website at www.fcatv.org. Such great thanks to Mateo for being here with us and sharing this powerful message, your story, as well as how you're now succeeding and helping others to perhaps, make safer decisions and find the path that is better than suicide.
For sure.
Thank you so much. And thank you for being here. We do hope to see you next time on our Foxborough Cable Access channels. Take care, Foxborough.